The 1980s, I mean, I would urge everybody who hasn't done it to go back to the 1980s, 1990s, look at the work by Philip Lathrop, restructuring healthcare. He was one of the first people, he was American, and he looked at the health service workforce as a totality, looked at how it fitted together, and I suppose from an efficiency point of view, came up with a really startling to us then, now a commonplace, but startling in 1980s, that a typical healthcare worker was actually doing healthcare for 20%, 25%, maxed out at 25%, let's say in the 20s. And there were these constants, whichever part of the workforce you looked at and wherever you looked at it, there were these constants. There was this massive amount of time taken up with scheduling and trying to communicate with other bits of the healthcare service. There was this massive chunk of time taken up in writing things down and filling in forms and feeding the information system. Decades later, we haven't dealt with it. But you could repeat that work today in a London hospital, you'd get exactly the same results. So to me, the issue is managerial. Whatever we've done, we haven't grappled with that issue. We've understood it, but we haven't dealt with it. And as there is an issue about scarcity of the workforce and greater demand, those sorts of inefficiencies really have to be dealt with. And it isn't about flogging, cracking a manager a whip and making people work harder. It's a system that's screwed up and unscrewing it, and getting it to work. And I suppose that's management's job. That's not nursing or physiotherapy or medicine's job. If you're going to have management, that's the sort of thing it has to do. Why in 20 years' time would you want to have both a midwife and an obstetrician attending the birth? Why would you have two professions attending a birth? Why don't you have one? Now, I haven't had an answer that satisfies me. I've had hundreds of answers that explain why in 1980 or 1880, why this has happened and why midwives are different from obstetricians, which I completely understand, but that's not the question I'm asking. The question I'm asking is why in 20 years' time would you want to replicate that system? And it leads you to a couple of sub-questions, which is what would you have to do to change that? And how long do you think it would take to make those changes? And my conclusion is that 20 years will go like that. You would blow away 20 years solving that problem.